Hello, everyone. My name is Elizabeth Manns, and I'd like to welcome you to the April 4th Coalition Show. This is our December 12th, 2022 edition of the show, and it's been 432 weeks since the closing of the North Adams Regional Hospital. The April 4th Coalition's mission statement is, we are for workers' rights and collective bargaining rights, and are against tax breaks for the rich and corporations who ship our jobs overseas. We support all the articles of the Universal Declaration of Human Rights, but has been our custom, we put the emphasis on Article 23. Dick, you want to go back to 1 and 2?
Okay. Number 1, everyone has the right to work, to free choice of employment, to just and favorable conditions of work, and protection against unemployment. Number 2, everyone, without any discrimination, has the right to equal pay for equal work.
Number 3, everyone who works has the right to just and favorable remuneration, ensuring for himself or herself and his or her family an existence worthy of human dignity and supplemented, if necessary, by other means of social protection. Number 4, everyone has the right to form and join trade unions for the protection of her or his interests. And as is a custom, we give a shout out to the radio station WMNBLP 107.1, and Michael Putnam, who is, I believe, still the program director, for airing the audio portion of this show on Fridays at 6 p.m. And of course to the fabulous David Fabiano for helping us produce the show. Okay, so I understand you're into paid sick leave these days.
Yeah, I thought that because of the last week we ran Bernie Sanders's very lengthy floor speech endorsing the Senate, encouraging the Senate to pass 7 days of paid sick leave
for the railroad
railroad workers who presently have none in their contract.
Right.
And so I thought we'd stay on that topic because it didn't give us a chance to talk about it much.
Last week, true.
And so I thought, first of all, there's a video that I found on YouTube that was made 6 years ago. So it's pre-pandemic.
Pre-everything.
But there are some issues that had taken place with restaurant workers and other healthcare workers. And the man makes a very good advocacy for paid sick leave.
Okay.
So I thought we'd listen to that 6-year-old
video
just to as a leaping off point. So
maybe the person working near you, the one who dragged himself or herself to work and is now coughing and sneezing, couldn't afford to stay at home. Each week, about 1.5 million Americans without paid sick leave go to work despite feeling ill. At least half of employees of restaurants and hospitals, two settings where disease is easily spread, go to work when they have a cold or the flu, according to a recent poll. To address that issue, Chipotle began offering paid sick leave to all of its employees in the United States this year. The restaurant chain is hoping to reduce the spread of infectious disease, like the norovirus outbreaks traced to its restaurants last year and earlier this year. Though many other industrialized countries already require employers to offer paid sick leave to all employees, the United States does not. Shocked you are, I know. That's the topic of this week's Healthcare Triage. Special thanks to Austin Fracht, who wrote the Upshot column this episode was adapted from. Paid sick leave is not free, of course. Economic theory suggests that its costs would be passed from employers to their employees in the form of lower wages or reduction in other benefits like vacation time. Yet employees and their coworkers may be better off with an incentive to take time off when sick. A number of recent studies point to the benefits. One by Philip Susser, now a medical student, and Nicholas Zebarth, a Cornell economist, backs up Chipotle's theory that paid sick leave could reduce the spread of contagion. Their study, published in Health Services Research, estimated that 45% of the American workforce does not have paid sick leave. That's about 50 million workers. Low-income mothers are particularly likely to work while sick. Another study in Health Affairs explains why. It found that families with less ability to afford unpaid time off are more likely to lack paid sick leave. According to the study, 65% of families with incomes below $35,000 had no paid sick leave. while the same was true of only 25% of families with annual incomes above $100,000. Paid sick leave slows the spread of disease. Cities and states that require employers to offer it, like Washington, D.C., Seattle, New York City, Philadelphia, as well as Connecticut, California, Massachusetts, and Oregon, have fewer cases of seasonal flu than other comparable cities and states. Flu rates would fall 5% if paid sick leave were universal. According to one estimate, an additional 7 million people contracted the H1N1 flu virus in 2009 because employees came to work while infected. The illness led to 1,500 additional deaths. Sick leave has other benefits besides reducing flu deaths. For example, workers may use it for preventive care, forestalling subsequent, more disruptive health problems. Workers lacking paid sick leave are more likely to delay needed medical care, a finding that holds for both insured and uninsured workers. In other words, though health insurance helps people pay for health care, it does nothing to help them afford to take time off and get it. Sicker workers may be more prone to job-related injuries. One study found that even within industries in which accidents and injuries are relatively more likely, like forestry, mining, and construction, workers with paid sick leave experienced fewer of them than workers without it. Another study found that employees who work while sick are more likely to have heart attacks than those who take time off. Paid sick leave may also enhance productivity and reduce turnover. One study estimated that the lower productivity of sick workers costs employers as much as their medical care. Children benefit from their parents' paid sick leave too. Most directly, it helps workers afford to care for sick children. Additionally, the children of new mothers who return to work more rapidly, perhaps because they lack paid time off, are less likely to be breastfed or to receive recommended medical checkups and immunizations. Though a few cities and states mandate paid sick leave, there is no national requirement. Under the Family and Medical Leave Act, enacted in 1993, employers with more than 50 workers must offer 12 weeks of leave within a 12-month period, but it's unpaid. Because of a new Obama administration rule, an estimated 300,000 private sector employees working on government contracts will get paid sick leave starting on January 1st. New York State recently enacted a law that mandates paid leave to care for a newborn or a sick family member, but it's not applicable to employees who are themselves ill. Paid sick leave is also not the only way to improve access to health care for workers. The ability to see a doctor or a nurse outside of business hours, for example, via telemedicine, or at a health clinic, at a drugstore, or other retail location, can also improve access to care. We tend to focus on healthcare coverage as the only way to reduce the cost of care to patients, but there are many other costs we rarely consider, time taken from work among them. Even when they are insured, many workers in the United States, unlike those in every other industrialized country, are exposed to this cost.
Well,
Yep. Well, I have a perfect example of it because where I work, we have the student workers as well. They don't have unpaid. They don't have any time unpaid. They don't have paid sick leave or anything like that. So some of them who desperately need the money come to work anyway. You know, if they get really, really sick, because MCLA has the COVID policy, they can't come if they prove out to have COVID. But if they just have the flu, they'll come in,
pass
to
it around.
pass it around. Yep. And it's the same thing. Whoever's got work study has to be low income, so they need the money to live at MCLA. So
Yeah.
they come along. It's not MCLA's fault or anything. It's just the way the system is set up for them.
It's like in Article 21 of the Universal Declaration of Human Rights. It says everyone has the right to equal access to public services in his or her country, you know, and
Right.
this paid sick leave,
Would
and the way it
become a
was
public
demonstrated
service.
in that 6-year-old video, that people who are of families of higher income, over $100,000 at that time, you know, most of them had paid sick leave, but the people of lower income, less than 35,000, was it, or less than 50?
Yes, less than 35,000.
Less than 35,000, they end up with no sick leave.
Correct.
And they're the people that desperately need the money, so they go to work, and they have the jobs that are least attractive.
Correct.
But
So they're also physically getting tired, and their
Right.
immune systems are going down, and the stress, you know,
Yeah,
and
it's-
trying to juggle everything, work and family, and
it
what you
should-
do.
in this country,
at
the
school.
richest country in the history of the world, we're told.
Yeah, we're told we're the richest.
And it's time that we start taking care of the needs of the people who, when they're sick, and children when they're sick, you know? And so we're advocating for that. Now, the reason why we're advocating for it, the initial reason was the strike that was averted by the United
government.
States government, first passed in the House, then in the Senate, and then the president signed the bill. He advocated with the Secretary of Labor, Marty Walsh, to get a good contract for the
Railroad workers.
railroad workers. They did get some financial 25% raises, but they didn't get the
paid.
sick leave that they needed. And
And
there were
did-
many instances where people were putting off getting
Go.
health care, and one guy
Engineer
died.
died?
Yeah, one
Right.
engineer was supposed to have a doctor's visit that he needed to go to, but then he was forced to go to work, so he canceled his appointment, and then a week later, he died while in the train, in the engine room of the train.
Luckily, the train wasn't moving.
Yeah, it's just a sad situation. So we have another video, though. The president, when he signed the bill, sort of apologized and said that he wasn't going to stop fighting for paid sick leave for Americans. So why don't we watch what the president has to say in this?
At the same time, we ensured workers are going to get a historic 24% wage increase over the next 5 years, improved working conditions, and peace of mind around their health care. And look, I know this bill doesn't have paid sick leave that these rail workers and frankly every worker in America deserves. But that fight isn't over. I didn't commit we were going to stop just because we couldn't get it in this bill that we were going to stop fighting for it. I've supported paid sick leave for a long time. I'm going to continue that fight till we succeed. And I want to thank Congress, Democrats and Republicans, for acting so quickly. I know this was a tough vote for members of both parties. It was a tough for me, but it was the right thing to do at the moment, to save jobs, to protect millions of working families from harm and disruption, and to keep supply chains stable around the holidays, and to continue the progress we made and we will continue to see on the economy.
So there he did make a commitment to
He
continue
did.
to fight for sick leave. And I think that's what we have to do. Maybe the railroad workers strike, even though they were shut down and forced to go back to work,
work.
maybe that'll be the
The impetus?
yeah, the
Is that the word?
Yeah.
Impetus?
to get everybody in America
Paid sick leave.
paid sick leave. It might not be today, it might not be tomorrow,
Tomorrow.
but it might be
But it's a fight worth having
right.
and continuing the struggle
Right,
for.
just like we're working to raise the minimum wage, and we're still struggling to do that nationally. Maybe paid sick leave will rise to
We'll
that.
follow. Well,
Yeah.
Massachusetts has a habit of leading the way. I mean, we're going to be at $15 an hour on the paid sick leave, I believe, in January.
And you mean the minimum wage? or-
The minimum wage.
Yeah.
Yes, I'm sorry. The minimum wage. My brain is flipping. And the fights that we've had in January, and we do already have paid sick leave on the books for everyone. I
Yeah.
believe, well, 90% of the population
Yeah.
can access it.
And I think
So-
what we were going to do is then go to
Well,
a clip by Bernie Sanders,
we were, but
who gives us an example of
an update on where
an
it is.
update on how things went, and even talks about how the vote came out,
Right.
you know.
And why it came out.
Yeah, so why don't we listen to that, and then we can have some comment
All right.
about that.
I know that many of you have been following what's been going on with regard to the crisis in the rail industry. Let me just mention to you that yesterday, on Thursday, we had both a victory and a loss on the floor of the Senate. The victory was that we had every single Democrat except Joe Manchin vote to make sure that workers in the rail industry got 7 days paid sick leave. We also had, surprisingly enough, 6 Republicans coming on board that legislation. So we had a majority of members of the United States Senate, but given the absurd rules of the Senate, you needed 60 votes, and we did not have the 60 votes, so we lost. I should also add that our colleagues in the House did a great job, led by the progressives there, in making sure that that legislation, that amendment passed the House. So I just want to say to the railroad workers out there, this is an issue we are not going to give up on. I'm a senior member of the Health, Education, and Labor Committee, and we're going to do everything that we can to end the absurdity of workers in that industry having zero paid sick days. And, you know, as I think many of you know, when we talk about the corporate greed that is sweeping this country, which disgusts so many Americans, I think that it's fair to say that the railroad industry in many ways is the poster child for that type of greed. You have an industry that in the first 3 quarters of this year made $21 billion in profit. They had so much money they were able to provide $25 billion in stock buybacks and dividends to their wealthy shareholders. And on top of that, the CEOs of the different railroads were making, in some cases, $20 million a year. One guy made $14 million a year. Other guy made $10 million a year. These guys are making money hand over fist. The business situation for the railroads has never, ever been better. They're rolling in money. And yet if you're a railroad worker today and you come down with COVID, you know, if your wife is having a baby and you try to get some time off, you get penalized for that, you can get fired for getting sick in the railroads. And that is, you know, literally unbelievable in the year 2022. And it's just an extreme example of the kind of corporate greed that exists in our country today. As Congress winds down now, this session, it is clear to many of us that we have an enormous amount of work in front of us. It's not only dealing with the crisis facing rail workers, it's the absurdity that we remain the only major country on earth not to guarantee paid family and medical leave, something we got to deal with. We are dealing with the reality that in America today, tens of millions of our people are hurting. 60% of the American people are living paycheck to paycheck. You got older workers out there who've worked their entire lives. They got nothing in the bank, scared to death about their retirement, which is why we got to strengthen Social Security. We have to strengthen Medicare and obviously eventually move to Medicare for all because healthcare is a right, not a privilege. We got to deal with the childhood poverty in this country. We got to restore that $350 a month child tax credit. We got to deal with the dysfunctional child care system that currently exists. Got to deal with housing, where we got some 600,000 Americans who are homeless and 18 million households who are spending 50% or more of their income, limited incomes, on housing. And obviously, it goes without saying, you got to deal with the existential threat of climate change, or we're not going to have much of a planet left to worry about. So there is an enormous amount of work to be done, and you know, in my view, the real change, the impetus for change, is not going to come from Washington. It's going to come from the grassroots of this country. When people stand up and fight back, that's when Washington pays attention and has the courage to go beyond their wealthy campaign contributors and lobbyists and the big money interests who have so much power in Washington. So we've got a lot of work in front of us. Despair is not an option. We've got to keep fighting. Let's go forward together, and thank you all very much for what you're doing. Take care.
So when did he tape that one? Right after the railroad?
About a week, the week after the railroad strike,
Yeah.
that Monday.
Okay. Well, I agree with him. I mean, big change, societal change, only comes when the grassroots demands it. You know, as FDR often said to somebody, "You're right, but you got to make me do it."
Right, when he was talking to the NAACP about integrating the Army. He goes, yeah, I want to do it, but make me. And that means that we have to stand up, you know, and instead of just sitting back and saying, oh, it's too bad.
Or saying government's going to take care of me. I need, you know.
It's too bad we don't have sick leave for everybody, and those poor people don't have sick leave. Just a little thing like calling your representatives and your senators. I know that I called them before they settled the railroad strike, and I explained that when I retired as a letter carrier, just prior to my retiring, I had over a year of sick leave on the books. You know, there's no reason why I, as a letter carrier, gets that sick leave, and why other people who live in America don't get it. I mean, I see that it is a benefit, but I think it's a benefit that everyone should have. And I
Definitely.
think Bernie talked in his talk last week that we played that if you work for the railroad or the transportation industry in this country, if you were a federal employee in the transportation industry, you would get paid sick leave.
You would, yes.
You'd get it, but it's just these people in the private sector that,
Aren't getting it, yeah.
right, we have these oligarchs running these corporations. We don't call them oligarchs, we call them CEOs. but
And
they-
their little boards, each one on their own
Yeah,
little group of oligarchs.
Right, but they make the decision that even though they have high profits and high wages,
Mm-hmm.
rather than investing profits
To
into
the
their
business.
employees and into making their employees
Employees
strong
back.
and healthy, they'd rather just do it for the short-term gain of their own.
Mm-hmm.
It's another demonstration about how we have to expand democracy within our country,
To
so
the
it's
board.
a part of our everyday life,
Mm-hmm.
so that, within companies, that there be some democratic representation to the people who are running the companies, that, they provide certain,
Services and advice.
Yeah, and if the guy at the top is getting all the sick leave he wants, then those at the bottom
Bottom.
should get a fraction of that, at least, have
Right.
a ratio, 1:8.
Even if you gave it a little bit of paid sick leave per year and you developed a pool for those employees to use or be able to give back or donate to if they don't use that whatever sick leave you give them
Right.
for that year, it could go into a pool for that person who's going to need it eventually.
Right, we could at the post office, we could donate vacation time, but we couldn't donate sick time to people.
Yeah.
And
Well,
that-
I know in the state of Massachusetts, there are a couple of unions who were able to negotiate that their members could create a sick pool.
Which would be very good, because sometimes, you come
You could
into a
donate your
situation
time.
where a family has a child that's very, very sick,
Mm-hmm.
and, requires them to be with them for an extended period of time, and maybe the children are young and the employee hasn't worked that
Right.
long in the company,
Correct.
and so they haven't accumulated enough sick leave.
To being able to be with the child.
Right, so it's something that's necessary, just like
yeah.
maternity leave too. And in Europe, it's not just maternity, it's paternity
Paternal-
leave too.
right, it's-
And it's
both
an
can kick
investment.
in.
It's an investment, when we take care of children, it's the most important part of a child's life is
First
when they're first born, and
Right.
in the loving care they get. And it might cost a little bit to pay parents to be home with their children when they're in infancy for up to a year, to be with them. But the long-term
Gain,
of it, the
Because-
child is more stable, doesn't need as much help in school, ends up,
The bond is
Li-
there, the sense of security
they
is
become
there.
better citizens, they don't end up in jail, they don't,
They don't drink, they don't,
it's
they don't
not a
become
problem on
addicted to
society.
drugs.
Right. We have to eliminate poverty,
Mm-hmm.
and the quickest way is to make sure that we take care of the children, the women
Mm-hmm.
and children, because that's the highest rate of poverty in the country anyways.
Oh, yeah, it
So
is.
when we're
The
providing
single
sick
mom. Mm-hmm.
leave, mothers should definitely have maternity leave, but they should also have, if you're a mother or if you're responsible for a child,
Mm-hmm.
you should have a set amount of sick leave available to make sure that you can care for that child.
Correct. You should, and you should be able to be home and take care of them. Right, because what else are you going to do? You can't take them to the nursery,
Right. And
to the nursery schools or the daycare
and if-
centers or
and if
whatever.
they're sick and if they're in contact with a sick child, but then they're still going to work, and like the husband and the
Mm-hmm.
wife or the other guardians are switching off, when they're going into work having been with a sick child, maybe with the flu or some other contagious disease, then they're susceptible to bringing that disease to the other workers. And the effects it has, a snowball effect, as
It
you
does.
the next worker gets sick, and then you have productivity goes down. You don't.
You would think this would make sense, but,
Yeah, and there's formulas. This isn't something that,
oh yeah. Any mathematician can figure out the thing for any company and tell the CEO, this is how much it's costing you in production of your product. And if you want your profits to stay high, you want productivity to stay at least stable, if not growing. You obviously want it to grow, but it can't grow if you don't have enough workers to produce the product and to produce a quality product.
and that's kind of the push why they don't want to give sick leave, because then people will use it. And the staffing levels that we've had in industry has been, we've been whittled it down year after year, eliminating
Getting
jobs,
jobs.
consolidating. You got the, they don't see.
Automation.
They're all looking at their own bottom line.
Right.
And not looking at what's best for the country or the society as a whole. Because, the goal should be in a society is not just to maximize profits and maximize stock prices. The goal should be to have as many employed people in your country as possible. Whatever extra profits you have should go to create more jobs. So
Should.
more people could work. And, it's that old saying, when everybody does better, everybody does better. And
And the-
a lot of those other problems that we cry about the crime, and we talk about theft and
Theft.
crime, and, I think if we could.
Homelessness, all those.
If we can create a society where we eliminate poverty, which isn't impossible,
Then
I think
all the other issues would
everybody
fade away.
would benefit from it. Everyone would have more security. There wouldn't have to be a fear that, you got to grab what's yours and hold on to it, because no one's going to look out for you if you run out.
True.
You know what I mean? If you set that
Set that
floor so no one can fall behind or fall through that floor, then people will feel more secure about it, and maybe they'd be more willing to share what they have in excess rather than
They might.
hoarding it.
Just because we have so little time left, I would like to remind everybody that it is the holiday season, and I believe are we going to be able to tape next week? Isn't that? Yes, we are. We are going to be here for next
I think so.
week. It's the week after we're not. I apologize. I thought we were
Yeah.
coming up on Christmas already.
we-
But it is still the holiday season, and there's many places where you can get to give for a child, a giving tree, or even to a family.
Right. They even have a Christmas tree at the Franklin Street Nursing Home where you can go and you can pick a
resident.
name of one of the residents, and they have a list of what you could buy for them and bring it up.
Bring it up to them. I
And
know
then
the
a lot of the churches have places where you can pick for children
Yep.
the same way. So power to the people, and share the wealth.
There's power in the factory, power in the land, power in the hand of the worker. But it all amounts to nothing if together we don't stand. There is power in our union. Now the lessons of the past are all learned with workers' blood. Mistakes of the bosses we must pay for. From the cities and the farmlands to trenches.